online. So holding people accountable in an inquiry way is really important. And then we get to our tier 3, which if you look on the PBIS website, it says that there's a multidisciplinary team and behavior support expertise, which is often why us as BCBAs are called in, because here comes that behavior support expertise. And here we go. People are at their max. We're seen as superheroes. Reminder, we're not superheroes. We don't work miracles, but we can help come in and support maybe when people feel like they're drowning. And so this is when a lot of times function-based assessments are introduced, and kids should have access to wraparound services if they need it. So providing maybe a licensed counselor to come in and talk to them. You might see some different things depending on the school. It's not set in stone, and it's not super clear. So IDEA, Individuals with Disabilities Education Act, requires schools to develop a BIP or behavior support plan if a student's behavior impedes their own learning or the learning of their peers. That's all the language says. So it's not explicit how you do this. And so some schools don't ask BCBAs to come in, and they're expecting teachers to conduct FBAs. And teachers overall, more honestly, I was shocked by these results that 67% felt that they could implement the FBA. But again, what I was saying is, am I going to want to go to a doctor for a surgery that's 67% prepared to implement my sinus surgery? No, I don't. And so a lot of times these teachers are conducting FBAs and they feel like they're not prepared to implement them. And these results came from that survey study earlier. And here are some teachers' roles: identifying positive reinforcement, identifying strategies to decrease, creating a crisis plan. And in my head, I'm like, these teachers don't have training on what we're asking them to do. And so that's why it's so important as BCBAs when we're coming in that we are providing that behavioral expertise. But also we want to make sure that it's kids who need it, and not just because that tier 1 is not in place. And Christina put a good point in the chat. Our district does not have consistency in who requires a BIP and who doesn't. And that is correct. And often sometimes it's the parents who are the most vocal, or the students that have the most externalizing behavior that they feel are disrupting the classrooms enough are the ones that get it. So teachers' perceptions of the process, some felt prepared, and tying it back. Here's our ethics code for behavior analysts, ones that stood out to me as ones that would be relevant for you to know or to share with schools that you're working with. The one that stood out the most, I'm in a few social media groups, and I just love to hear what people are saying. And there's always questions about obtaining informed consent. And so our code states that we're responsible for knowing and complying to all conditions which are required to obtain informed consent. So gray area here, not black and white, but when it comes to IDEA, a school must ask for parent consent before they conduct an initial evaluation. So that means that the student is not yet receiving special education services. They don't yet have an IEP, but they're wanting to conduct that initial evaluation. Or a reeval means that they might think that the disability category might change, or they need to add services. And also, before the school provides special ed services to a child for the first time, before inviting non-school agencies to participate in IEP meetings to discuss child's transition to adult life. So transition age, I'm drawing a blank, but I believe it's 14, 12, might even be as early as 12, where we're starting to talk about transition out of school. And so before you come in to sit on IEP teams, if we're talking about transition skills, there should have been there should be parent consent. And also before conducting any assessment or evaluation on a child with a disability. That is why it's essential before you go in and see a kid, that you ask, do they have an IEP? If it's yes, then you have to have parent consent before you conduct an assessment. I know so many kids that have IEPs that don't yet have FBAs or BIPs. There has to be parent consent. before an FBA happens, which means that you have to have parent consent before you go in and do your observation. And so it's really important that we ask those questions of, does the child already have an IEP, or are you looking at an initial evaluation? So those pre-meetings, create a contract, ask to review student data, review what interventions have been in place, listen, and asking the team. So does the student have an IEP? Are we wanting to start the process? Has consent been signed? All right, we're not gonna get to all of these, but let's talk through, now that we have some knowledge. You can think, you can type in the chat. Here's a scenario. You enter the classroom to do a student observation and it's chaos. There are no routines. There are students up out of their seats. One's doing cartwheels. The teacher's repeatedly yelling, no, sit. What do we do? Mm-hmm. Who's doing the cartwheels? You? All right, here's what I would do. So I would, again, make note objectively of everything that I'm seeing. And then I would go to take data, objective data. And I would go to the administrator or whoever it was that asked me to do the observation. And I would say, hey, do you have a second? I'd love to sit down with you and share what I saw. And you could say, I'm not an expert in this, but I have seen research that shows that having positive behavior intervention supports in place at the classroom-wide level. I have some information of what that looks like classroom-wide. I'm not seeing it here. And so I don't feel confident in saying that this student needs tier 3 supports when the tier 1 level looks like this. And so I'd be happy to talk about that further with you. But what I'm seeing is that there are no routines, there were no expectations, and there was a lot of negative feedback. And this is how the student responded to what was happening in the classroom, is how I would begin the conversation. And so I would not directly just write a behavior plan or, take note in the observation. Again, not being evaluative of the teacher, but just saying, I think this student would really benefit from predictable routines, set clear expectations, more behavior-specific praise, things like that. Okay. This is a real-life example. A student is known for having attention-seeking behavior. The teacher continually reinforces this behavior by talking to the student when he calls out or walks up to her while she's teaching. And I'll note that it was in the behavior intervention plan that she is not supposed to do this. Ideas? All right, we'll jump in. I would have a conversation with the teacher. Again, that collaborative, getting that culture of collaboration. Matt clarify the why behind teacher behavior. Yep, having that conversation. Hey, this is what I noticed happening. Not sure if you realized, but you were reinforcing his behavior by him continually coming up. Is there anything that you want to share? Is there a challenge, a barrier? What's happening here? Anything I can do to help you? And reviewing those plans. Yep, Christina, exactly. See what the barriers are, but don't be afraid to have those conversations. They need to happen. And so if you already have that culture of collaboration, or you're coming from it with an inquiry lens, a problem-solving lens, a working together lens, then we can take out some of the defensiveness. You might still have teachers that are defensive, but we can remind them this is the plan. This is what we're going to do to try to help the student and you be more successful with everyone. All right, this one I saw on social media. You're called in to observe a student and are told the parents do not know and have not provided consent because it's just a planning tool. Not good, not good. That's why those conversations are so important. Sorry, this was a student with an IEP. And so this happens a lot. And so reminding of the ethical code, run, Patrick, you're right, run far. So find out, do they have an IEP? Have the parents been notified, have they signed consent? And if they say no, then say, please let me know when the parent signs consent, and then we can set up a time to do the observation. Got to stick to your code. It is found that the student is not, okay, we're going to skip that one. This is a good one. This is the one I really want to, this is another real life example. A student begins to punch, kick, and lunge at her RBT. The RBT begins to walk out of the classroom to take the student on a walk break. The teacher asks if the RBT needs help, and the RBT says no. Now the student and RBT are alone in the courtyard with the teacher watching from the window, and the student is continually lunging at the RBT. What do we do here? So for time's sake, and normally I give more wait time, so I apologize. But first, I'd have a conversation with my RBT that they are not to be alone with a student in a school setting, and taking that back to the administration or whoever it is that's asking you to come in, having those conversations of, do you want to be alone? We don't feel comfortable being alone with students. So what steps or what should we do if the student needs to leave the classroom? Who should we call? So Christina put, the teacher needs to teach the class, so the RBT needs to ask to help from the team. So who is that team? As a BCBA, I want to tell my RBTs, this is exactly what you do. This is who you need to call, or the teacher has a routine of hitting the, whatever it is, not hitting the button if it's going to set the kid off, but some way to know how we can move forward with this, because we don't want to be put in a situation where we're alone with the student, especially if they're escalating, because we want to make sure that the school is involved in watching from a legality standpoint as well. So I'm going to skip through these real quick so we can finish up, because I know I'm over. But these kind of went over, this was another real life example. You might see that a student is overwhelmed, for example, like the academic instruction that or independent practice is not at the student's level. And so it's hard when we might not have, that might be outside of our scope of competence, is to be providing academic advice or modifying it. But I think it's important to have those conversations with, this is something I noticed. When you give him a worksheet with 45 problems on it, that's the antecedent to flipping the desk and punching me. And so is there any way that we could maybe give him one math problem at a time, give him a strip of math problems, somehow know to decrease that amount. But having those conversations of, I'm not telling you what to do, but this is an observation that I noticed, because I see this a lot as well. And so we want to make sure that these recommendations are being put into place, and a conversation that we can have. You should never be solely writing the behavior improvement plan on your own. It should be a team of people that are working together from the school to help you write it. And you should always be sharing the results of your behavior improvement plan and your FBA with the parents or caregivers. Tips to remember: create a culture of collaboration.